Anterior pelvic tilt refers to the pelvis bending forward like this. The other deviation is called posterior pelvic tilt, which is the opposite. That's when the pelvis bends this way, like that. Anterior pelvic tilt looks like this. Posterior pelvic tilt. If you have anterior pelvic tilt, then you'll want to stretch your quadriceps muscles and your psoas muscles. And two simple stretches for those are as follows. Find a wall to stabilize yourself. Lift up your foot, grab your ankle, knee pointing straight down, and just pull your ankle straight up. And just hold it for about 30 seconds. And relax. And do it again. Do it about 3 times. Another exercise to stretch the quadriceps muscle, if you have a hard time balancing, is putting a pillow on the floor and putting your knee on top of it and stretching it that way, as follows. Make sure your knee is nice and comfortable, and just bend this knee and you'll notice a stretch to that quadriceps muscle. Bend it as far as you can to tolerance. Now with the anterior pelvic tilt problem, you may also want to strengthen the hamstring, and a simple way to do that is just to do leg lifts using an ankle weight or a TheraBand, and I'll show you the exercise with the TheraBand. So what I've done is I got some TheraBand tubing and I made a knot and placed it under a door. Make sure you put a sign there so that no one opens the door while you do this exercise. I'll stick my foot through it like this, and the exercise is simply just lifting your foot up like this several times. With posterior pelvic tilt, the idea is that your hamstrings are too tight and your quadriceps are weak and need to be strengthened, the opposite of the anterior tilt. So what you'd like to do is stretch out the hamstring muscles, and this is your basic runner stretch, like your hurdler stretch, and I'll show you that shortly, and strengthen the quadriceps muscles, and here are the exercises for those. To stretch your hamstrings, find a wall and back up until your sacrum touches the backboard and attempt to straighten out your knees. Okay? Chances are, for some people, you're not going to be able to do that. Your knees are going to be bent like this because the hamstrings are so tight, but do your best. Use your arms to push yourself flush up against the baseboard of the wall, and also bring your head back so the back of your head touches the wall, and you could try to push down those knees. Okay, get it till it's a really good stretch there, more, as much as you could take, and just hold it. Avoid bouncing like this, but just put constant pressure down. If you can extend your knees all the way, that's even better. You still should feel some tightness in your calves and your hamstrings, and then bring your toes and point them towards your stomach. Keep your hands relaxed. Remember to keep your head against the wall, and it would help to pinch your shoulder blades a little bit together and your shoulders against the wall. And just hold that position for about 30 to 45 seconds, then relax. And do it again. Repeat about 4 to 6 times. You could also switch it up by doing the hurdler stretch. Bend one of your legs and put the bottom of your foot against the inside of your knee and grab forward your ankles, or as far down as you can, and then pull your head towards your hands like this. Pull it down as low as you can. Once you've hit that spot, hold it there for about 30 seconds, relax, and do it again. Repeat 4 to 6 times. A third stretch for your hamstrings, you stand up, cross your right leg over your left, and just bend forward as far as you can, keeping your knees locked like this. Now for strengthening the quadriceps, the best exercise for this are good old-fashioned squats. Feet shoulder width apart, hands on your hips, and just sit down. Just like this. Keep your back straight, just like that. Using the TheraBand, you could also strengthen your quads by doing this. Make sure you have something to balance yourself and just extend your knee out.